Hello and welcome to the Functionally Enlightened podcast with Dr. Sharon Surita. We interview well-respected medical and functional practitioners, as well as patients who have overcome disabling chronic conditions, such as dysautonomia, and reclaimed their health. These enlightened guests provide helpful tips on managing chronic pain and illnesses, using a combination of traditional and whole-body healing modalities. If you're interested in natural healing and quality of life improvement, you're in the right place. Thank you for listening to today's episode.
Hello, everyone. Welcome back to the Functionally Enlightened podcast. Today, we have our special guest, Ethan Pompeo. His journey into functional wellness really began with the life-altering diagnosis of PANDAS, and that is a complex autoimmune condition that left him particularly navigating years of debilitating neurological symptoms. After about a decade of exhausting pharmaceutical interventions with limited relief, Ethan really took his healing into his own hands. His discovery of CBD oil became a turning point, calming his tics, restoring his focus, and offering real quality of life for the first time. Armed with a background in science and technology, Ethan founded a disability-owned wellness company committed to transparency, purity, and real results. His mission? To help others quiet the noise, whether it's physical inflammation or neurological overload, offering clean, natural solutions rooted in lived experience and integrity. So welcome, Ethan. We appreciate you coming to our show.
Thank you so much. Yeah, wonderful job with that introduction. There's nothing more to talk about. Just kidding.
We just mentioned that you were diagnosed with PANDAS and that changed things for you. Can you help our listeners understand what PANDAS is and how it affected your day-to-day?
Yeah, absolutely. So it was a long journey to actually get a proper diagnosis, mainly because it can be difficult to diagnose PANDAS. I, out of nowhere, started exhibiting neurological symptoms like tics, motor tics, verbal tics, loss of motor function, severe anxiety, OCD, intrusive thoughts that wrecked my quality of life. And when I say out of the blue, I mean I was normal and healthy one day. The next morning I woke up and I started having these tics seemingly out of nowhere. To explain what PANDAS is, it is a complex autoimmune disease, but when you break it down, it's really a strep throat infection or other infectious agent that causes an unusual autoimmune response in the body, namely excess production of antibodies. And so when we look back at my blood work and my medical history, we can see that my strep antibodies were off the charts. I mean, my body was constantly trying to fight off this infection. And antibodies, they're meant to help us, not hurt us. But the problem is when they are present in excess, like they are in a classic PANDAS case, they can cross the blood-brain barrier and cause inflammation or encephalitis of the brain. And that's exactly what happened to me. My antibodies started attacking my own basal ganglia, which is the motor cortex of the body, and I started exhibiting all of these symptoms as a result of a bacterial infection that I had.
Right. So what were the first symptoms that really were prominent for you?
The first symptoms, so I remember the first thing that I ever dealt with was a skip step. So my family and I were actually taking a field trip to an amusement park nearby. I live here in Central Virginia, and we were very excited. It was going to be a fun day, and all of a sudden I had this skip step where I had to tap my right foot twice as I walked. And it wasn't a huge deal, didn't interfere with my life too much, but it was noticeable. And my parents, I think, initially brushed it off, thinking, oh, he's just a young kid, he's doing something weird, it'll go away on its own. But from there, it manifested into many other tics, and to the point where it interfered with almost everything I did on a daily basis. Anything I picked up, a phone, a pencil, a pen, a fork, any kind of utensil, I'd have to pick it up and throw it and catch it in my hand until it felt just right. And if it didn't feel just right, I had to put it down and repeat over and over and over again until it did, until it satisfied that compulsion that I had going on in my brain. And so what would happen quite often is that object would end up sailing across the room as I got so frustrated that I just couldn't take it anymore and threw it. And so as a side effect of these symptoms I was dealing with, I dealt with a lot of frustration and anger and isolation as a product of the PANDAS that I was dealing with.
Understandably so, for sure. I know that I do witness some of these behaviors or mannerisms in people, and there's no way of knowing if they were exposed to a virus such as you
Mhm.
were experiencing. But other things that can trigger this inflammation of the brain, do you know of any other ones offhand that you see pretty routinely?
Yeah, so strep throat is the most common, but we've seen it with uh, viruses, we've seen it with parasites, so Lyme disease, we've
Mhm.
seen it with mold, mold toxic exposure. Really, it seems like almost any pathogen, if not treated early on, has the potential to cause these greater effects in the human body.
Yeah, absolutely. So I know many of our followers, they are navigating autoinflammatory or autoimmune conditions themselves, or maybe they have children that are. And we talked a little bit about the early signs that you experience. Do you see anything routinely in other people that you've worked with or while developing, and we'll talk about your products in just a little bit, but while developing your products, did you see things that were popping up all the time
In terms of symptoms?
in terms of symptoms or maybe diagnoses that they may have received?
Yeah, I certainly do. I will say, really the reason I got into the whole CBD oil thing is because it was the one thing I found that gave me relief. So between the ages of 13 and 18, I was misdiagnosed with Tourette syndrome. It was basically a label that I was given by a physician to say, you know, here's some prescription medication. Try it and see what works. We didn't know what caused it. We didn't know how to treat it. We didn't know if there's a cure. It didn't really do anything for me other than, get me in that paradigm of conventional medicine and using prescription drugs to treat my symptoms. Meanwhile, the underlying cause of my illness remained completely untreated. The
Mhm.
bacterial infection I was fighting continued to fester within me, which increased my inflammation, which increased my symptoms. Meanwhile, we're trying to like push pills at these tics and compulsions. It's crazy. It's not scientific. It doesn't work. It
Yeah.
doesn't help anybody. And I remember the side effects of many of these medications I tried outweighing the benefits. I remember feeling lethargic and like a zombie, and just it was not a good way forward. And by the time I was 18, I had been on over 40 different prescription
Mm.
meds, just trying to find something that worked.
Yeah.
Until the point I reached a point where I had physician fatigue. I was just like the 18-year-old me was sick of doctors and pharmacies and treatments and pills, and I had just had enough. And you know, moving into CBD, I found out about CBD quite by accident. I had been using cannabis really illicitly as a way to manage my symptoms because I truly think that the chronic use of prescription medication throughout my adolescence normalized substance use and abuse in my
Mm.
worldview and in my mind. And so for me, trying a plant-based compound like cannabis was really no big deal. I come from a very conservative family, so to my parents, it was a big deal. Like they didn't want me doing it at all. They thought I was losing my mind, going down the rabbit hole. And for me, it was just, I remember the first time I used it, it was like this wave of anxiety was lifted off my shoulders. I could take a deep breath. My tics and my anxiety went away. I felt more normal. Now, I don't condone the use of cannabis. First of all, THC, the psychoactive compound in cannabis, is certainly not for everybody and certainly
Hmm.
not for kids. There
Right.
were many side effects I faced as a consequence of using that, including sometimes increased anxiety, just variability from batch to batch and dose to dose. It's not tested, it's not consistent. I had run-ins with the law enforcement as a teenager, which was very unfortunate. Also increased my anxiety. I had many problems, and just in and of itself, inhaling particulate matter and combustion and smoking is hazardous for your health. So it's not something I condone. However, it was the only thing I found that worked. So
Mm.
just moving on, as I learned more about this plant and as I explored the world, I found out about CBD, which is a cannabis compound, but it's completely non-intoxicating. It's THC free. I call it nature's most powerful anti-inflammatory. And what it did is it reduced the inflammation in my basal ganglia so that I could think better, think more clearly, live a better life. instead of just masking the symptoms, it was actually reducing the inflammation that was causing the symptoms. It was a more holistic solution for me that came with almost no side effects or negative consequences. You know, I didn't have to smoke. I didn't have to carry an illegal substance around with me. You know, there's no dependency. It was just like an answered prayer for me personally. And so that was kind of my deep dive into this. Since then, there's been many clinical trials and data supporting the use of CBD for certain seizure disorders and
Hmm.
epilepsy. It's been shown to reduce anxiety in many clinical trials. It's been shown to support sleep. It's been shown to reduce inflammation and certain forms of chronic pain. So those are like the top uses that my customers report using our products for, like just helping them feel better and live better and sleep better and taking the edge off their anxiety, all naturally. So I
Right.
think it's an amazing product.
Ethan, I love that you touched on the inflammation piece because that is essentially the number one thing in the chronic illness community that we
Mm,
need to strive to do. Inflammation coming from all of the daily toxins that we're exposed to, whether they be physical, mental, or emotional. All of these things impact the body systemically. So I appreciate you touching on that. And just in my own personal experience, I did try the medical marijuana route during the height of my chronic pain episodes.
mm,
Mine resulted from multiple surgeries with hernia mesh and, having to have a mesh explant afterwards. But for me, that it didn't provide that particular type of marijuana did not provide any benefits whatsoever.
mm.
And in essence, when I tried different dosages as prescribed by the practitioner, I did have a seizure after that. And so I kind of
Oh,
shied
goodness.
away from the use of course, this is not just CBD, it's the THC. So
Yeah.
for those who are curious but hesitant about trying CBD, what should they understand about the safety and sourcing and effectiveness that your products can offer?
Yeah, absolutely. The biggest thing to note is that CBD is not a marijuana product. This is not inhaled. It has no psychoactive effects. I think THC has been shown to have beneficial properties for
Mhm.
certain things, pain management in particular, but I think it should be reserved for like people who are undergoing chemotherapy and stuff like that, like severe problems. I mean, if it can help with pain, that's great, but clearly it's not for everybody. It made things worse in your case. And anyway, if I were to do it today, it would be a totally different story. I'd be a space cadet, stressing out. It's not for everybody. CBD, on the other hand, so there's THC, the intoxicating compound in cannabis, the notorious compound, and then there's CBD, it's a totally separate compound. It comes from the same plant, but I like to describe it like breeds of dogs, right? We've got German Shepherds and Chihuahuas. They're both dogs, but they're completely different. They look
Mhm.
different. They have different purposes, right? They sound different. They're almost different animals, but scientifically, they're both canis, like canines, right? So same with CBD and THC. They both come from cannabis sativa, but they're completely different compounds. CBD, there's no risk of getting high. You're not going to fail a drug screening by taking CBD because the compound they're testing for is excreted by the liver when you consume THC. So CBD is safe for virtually everybody, including kids if it has zero THC. And in my opinion, I would have loved to have had access to CBD as a young adult because it would have made my journey a whole lot easier.
Mhm.
So that's how I like to describe it. CBD, like I said, is a powerful anti-inflammatory, but when taken appropriately, it can have myriad benefits in addition to relieving inflammation. It just helps me to feel at peace and at ease without the other side effects that come with cannabis use.
Right, and that is a critical component. We talk a lot about neuroplasticity and taking yourself out of the mental fight or flight. So I imagine
Mm.
that this CBD can help tame that kind of like a cortisol response that we have when we're in chronic pain or chronic illness in general. So I know you have that background in science and technology. So how did you use that to shape the way you approached wellness and build the supplement brand?
Yeah, so I guess going back to my undergraduate degree, I studied science and technology and systems management. Um, Creating these compounds, purifying them to the point where they're clean, trustworthy, safe. It's a lot of work. Like we're not just like selling a plant material, right? We have to extract the oil from the plants, we purify it, we distill it down to a very pure form. We use that active ingredient to manufacture. I think we have 30 different products at this point, and everything is third-party lab tested. So we're screening not only for potency and purity, but any adulterants and contaminants, residual solvents, mycotoxins, residual compounds from the agricultural process like pesticides and mildew and molds.
Mm.
It's something that I take every day. My wife uses our topical pain cream on her back and shoulders to help her sleep at night. We're ingesting it on a daily basis, and we want it to be clean and trustworthy just for our own use. And quite frankly, that's how my business was started. I started formulating these products, trying different concentrations and different applications to see what worked best for me. And pretty soon people were asking about it. You know, my friends wanted to try it. What are you doing? Is this legal? Grandma wanted to try it for her achy knees. Grandpa wanted to try it to sleep better at night. And pretty soon I realized, man, there's a real need for alternative therapies in the world at large. You know, people are tired or unwilling to try medication, and this is something that they may be open to, knowing that it's not intoxicating and it doesn't carry those risks. And that's what I found. Uh, Moving forward into Virginia, this was about 2015. You could not find CBD. I mean, it was near impossible to get your hands on, and this was something I had come to rely on now. You know, I didn't want to go back to that illicit use of cannabis. I wanted to take a medicinal, safe approach, but I couldn't find this stuff. So I started manufacturing it myself in the spare bedroom of my house.
Wow.
And fast forward to today, we operate a state-of-the-art manufacturing facility. We're under inspection of food safety and many other authorities to make sure that everything's done to a very high standard. And we're offering a product that truly helps people. I've shipped to all 50 states and even internationally now, and it's just amazing how many people we've reached. You know, the testimonials speak for themselves. I tell people I would have been burned out long ago
Mm.
if it wasn't for the feedback I get from my customers saying, "Oh, it's changed my life. Oh, it's helping me live better. Oh, I feel better now." Like those testimonials are worth their weight in gold, and that's what keeps me doing what I'm doing, to know that we're impacting people's lives like that.
Precisely. And you have that lived experience. So you know what it's like
Mm,
before, during, and after using
absolutely.
it routinely. So let's talk about a little bit more on the products you mentioned. You have about 35 different products, and I know that you do offer some for kids, but let's talk a little bit about the kids' products you offer, and then we really want to dive into those with chronic pain.
Sure. So all of the products use the same active ingredient. We're focused on CBD isolate, which is an isolated form, a pure form of CBD. It's CBD oil and nothing else. So again, no THC, no volatile compounds, no fatty acids or residual plant compounds, just CBD and nothing else. And the reason we do that is twofold. One, like I've mentioned, it's safe for everybody, right? The other reason is that it's consistent from batch to batch. There's a whole bunch of CBD products out there. There's some what are called full spectrum or broad spectrum, and that just means that they've skipped the secondary part of our extraction process and just dragged the oil out of the plants, and putting that into products. And now, if that works for you, great, you know, stick with it. But the problem is it's not consistent from batch to batch. Depending on where you get your plant material, how you extract it, where it's grown, when it's grown, that chemical compound, that makeup of that product is going to be different from batch to batch, from month to month. And so you never know exactly what to expect when it comes to the results you get from that product. By isolating the pure CBD, what we've done is made sure that our product is the same 6 months from now as it is today. You know, if the bottle says there's 1,000 milligrams of CBD in there, then
Mm.
there's 1,000 milligrams of CBD in there and nothing else, and it will be true every time you get your hands on a bottle. So that I appreciate that again because I know what to expect. I can take the same dose every day and get the same results. So it's just a more medicinal, more focused approach. I just wanted to explain how that works before I answer your question. But
Yes,
again,
I
all the
love that
products.
clarification because we hear the term full spectrum and we think that that's the optimal type. So I appreciate that.
Right. Yeah, not necessarily. The research is still not where we need it to be to really understand the benefits between a pure CBD and a broad spectrum, CBD with other compounds in it. So there's more research and more science needed to understand that effect. But again, this is the approach we've taken, and I can tell you it works. It's helping a lot of people. So that in and of itself says a lot. We also, right now, we have our product is undergoing an FDA approved clinical trial with the University of Virginia Health System. And what we're looking at is the effect of CBD, oral CBD, on chronic pain management and post surgical recovery.
Nice.
And I am very excited to see the results of that in a few months or whenever we wrap up that trial, because, I've got thousands of reviews of people anecdotally saying, yeah, this helps me with my pain, this helps me feel better. But to have that empirical evidence through a clinical trial that it works will be enough to push some skeptics over the edge, I feel like, to try this because, the osteopedic surgeon that we're working with, he wants to provide an alternative to opioids for his patients, so you don't
Mhm.
get out of surgery and then get addicted to opiates and be in an even worse position, right? If CBD can do that without the addictive potential or the harmful side effects, that would be an amazing solution. So that's what we're trying to offer. And when it comes to products for kids, the CBD that's in our products for adults is the same that's in our products for kids. The only difference is the concentration of the active
Mhm.
ingredient. So our kids' oil is just a low concentration, whereas adults take about anywhere between 20, 25, upwards of 50 milligrams for an adult therapeutic dose. Uh, we target the children's products more in the range of 10 to 12 milligrams, so about half the dose of an adult. And that's where we typically recommend people start out with if you're using it for kids. And of course, everybody's different. I think dosing is the number one question we get. How much should I take? How much should I give my child or my dog, right? And the answer is different for everybody based on like what conditions you're facing, the severity of those conditions, your body weight, your metabolism, your lifestyle will all affect the dosing of this product. So it's really difficult to say, oh yeah, take 10 milligrams and you'll be good. Like it takes a little bit of trial and error to find the dose that works best. So what we always recommend is just start with a low dose, one serving size, if you will, and then just move up slowly as needed to find the dose that works best for you, with the whole idea being taking the minimum amount of CBD to
Mm.
achieve your maximum benefits.
Right, right. And what kind of symptoms in children does your product aim to treat or to help manage?
Yeah, so our customers report amazing results using it for um, autism in particular, ADHD, restlessness, moodiness, sleep disorders, like all the things we probably have faced or our kids have faced uh, during young adulthood. It just calms the anxiety and helps you to focus, and that's been my experience. And so you look at these kids who have difficulty with their cognitive behavior, they have difficulty expressing themselves. When I was in my deepest battle with pandas, it was so hard to just get out of that rut and escape that cycle. I mean, I was physically stuck in my symptoms and my tics,
Mhm.
but beyond that, I was just trying to get through the day, dealing with the severity of the symptoms that I faced. It was just very, very hard. And after you deal with that all day, the last thing you want to do is come home and like talk about it
Right.
or talk to your therapist about it and develop a solution. Like you're just trying to get through the day and be normal.
Mm.
And so for me, having a tool that kind of just takes the edge off gives you a little bit of relief so that you can take a deep breath and refocus. Like sometimes that's all you need to then like refresh your mindset and think, okay, what are some other things I should be changing and adapting in my life to live better? So while I do believe that CBD is an amazing tool and an amazing option, I think the larger healing opportunity is with lifestyle change and using CBD as a tool and a catalyst to get there. but I'd never sell it as a miracle cure. There's no miracle pill that you can take that will just make your problems go away like poof.
We
Like
wish, yeah.
we wish that's the American dream. Like at this point, we're a sick culture and everybody just wants an easy way out, an injection, a pill, whatever to make your problems go away. Well, that's just not how it works. Our bodies are designed for a purpose and to do certain things. All of us need to eat right. So for me, it's an anti-inflammatory diet, right?
Hmm.
Staying away from sugar and processed foods and these things that just fill our stomachs with junk. Staying away from that, getting in an exercise routine. Weightlifting has been incredibly beneficial for me in terms of building up high muscle mass. My functional medicine doctors described the muscle mass I've gained as a sink for inflammatory compounds. So it keeps those inflammatory compounds out of my brain and helps me to live better and function better. It's just amazing. And so eating a protein-rich diet, anti-inflammatory diet helps with that. CBD helps with the muscle recovery and the soreness, and again helps me relax so I can get up and go to the gym. Getting rid of stressors and anxiety triggers, things that really made me tick in a bad way, and things that bothered me. Just finding ways to get rid of those in your life and live a more um, just holistic and calm and joyful lifestyle is huge. I always tell people like find things you're passionate about and cling on to them. For me, it's playing the drums, uh, riding my bicycle or my motorcycle. All makes me feel free. I have no tics while I'm doing those things because I'm just so focused on what I'm doing. I feel full and I feel very human. And so finding those things, those outlets, and really diving into them is very healing.
Right, Ethan, I appreciate you covering that because I was going to ask for some practical things that you'd recommend for anyone dealing with
Yeah,
these type of neurological symptoms. So you did name a few. I like the weight training component of it, and that's not always doable for some of the people
right.
that I serve. However, there are different things that people can build in, even e-stim that might help with the muscle contractions, and ultimately like reducing the fatty tissue, the adipose tissue, because that's what's storing more of the toxins in the body.
Yeah.
So as you're doing all of these things and you're using, the adjuncts, the supplements, and the CBD in this case, all of those things do come together as like the foundational steps to having a more functional and optimal life.
Mhm.
So among those things, are there some that take precedence over others, aside from like finding the purpose and finding the things that bring you joy?
I think that there's a lot of truth in the body mind spirit connection. If one aspect of your health is out of whack, like let's say your body is suffering, you're dealing with chronic pain, well, that's going to affect your emotional state as well. Like your mind is going to suffer as a result of, you may have a healthy brain, but if your body is in pain all day, that's going to affect your mental state tremendously. The same is true of mental health. You may have a healthy body, but if your mind is deteriorating, like your body is not very useful at that point. So just doing things to encompass the body, mind, and the spirit, focusing on all three areas of health and optimizing those so that they work together as a system. That is the key. And I've personally experienced that in my life, dealing with the tics, the motor tics. My mind is cognizant and conscious of what I'm doing, and I know it's unusual. I know it's weird and not normal. That is a very defeating thought. And for years, I felt very ashamed and self-conscious and isolated with regards to what I was going through. I didn't want to talk about it. I just wanted to pretend like everything was fine and get through my day. And that was not a healthy place to be, just carrying that burden on your shoulders, shutting people out. Uh, the other piece of advice I would give people who are struggling with not just pandas, but any kind of disability or health problem is just be open about it. I mean, don't be woe is me, like telling everybody about your business and your problems, but you know, I, people would see me sitting and twitching and ticking and doing my thing, and out of genuine concern, I mean, every day someone asks, "Hey, are you okay?" And I used to just shut them down, like, "Yeah, yeah," and brush them off, and that wasn't helping anybody.
Mhm.
By transforming that viewpoint, and now when people ask me that, I say, "Oh yeah, it's okay. I have these tics. It's something called PANDAS. I'm fine. I'm not having a seizure." They're like, the response is completely different. Like
Right.
instead of being brushed off and concerned, they're like, "Oh, okay." And then they don't ask me about it anymore. It's like not only am I like being real with these people and taking the pressure off myself to have to bottle this up and deal with it by myself. Like
Hmm.
I'm putting myself in a position to raise awareness for this condition. And who knows, much of the time I tell people about this and they say, "Oh, like my nephew has tics. Maybe it's pandas," or my next door neighbor's son has pandas. And it's been a way to just connect with people, raise awareness, and become an advocate for this instead of just pretending like it doesn't exist.
Right, right. We just interviewed Dr. Lauren Tessier too, who really dives deep into mold and how
Mm.
it does impact us neurologically. And I think she mentioned stuff about the pandas. I guess you can call that a pandemic in itself too, because of the constant exposures and all the triggers. We can't really name them all. But when you kind of mentioned a little bit how you got into a clinical study with University of Virginia, was it?
Hmm.
Can you tell us a little bit of how you got involved in that? I am a researcher myself and, involved in clinical studies, and I really love to hear how other people are getting into the science of it.
Yeah, it's another one of those things. It's kind of serendipitous. I've been involved in the CBD industry here in Virginia since before it got started, really, like when the Farm Bill of 2018 was passed to legalize hemp and hemp products, I had already been using these products and sharing them with people. And so I have created quite the reputation in our area for what I do. And I actually, the researching physician had reached out to me basically saying, "Hey, I want to do this trial. I'm looking for a trustworthy source that's local. Would you be interested in working with us?" And it was kind of a coup because they just came to me. It was a perfect relationship. And, there's been a lot of work to do on the back end regarding the FDA application and the IRB approvals and everything like that. But I just thought it was really remarkable that they valued working with a local business and that they saw the research I was doing. They saw the lab testing I was doing, the product vetting I was doing, and that they wanted to work with me out of all the companies they could have reached out to. So I thought that was great. It's been a pleasure working with them. This has been ongoing for quite a while. I
Mm,
understand these things take time,
yes.
but I am hoping to have some results and a better insight into this very soon.
Right, right. And I'd love to see the research as you get the peer-reviewed papers out. And, I'm sure there's multiple PhD students that are really taking interest into
Mm,
this specifically.
I'm sure.
Yeah, yeah. So with that, we talked about the practical things. Also, you mentioned, I think you said the phrase quieting the noise. Can you explain what that really means for you and how others can begin to do the same?
Yeah, that's a phrase that we came up with in the very beginning of our company, to say like CBD is a tool you can use to quiet the noise of anxiety. You got all this clutter in your head, and especially with pandas, it's like you have these triggers, it could be an audible noise. For me, it could be someone like t scratching their nose and scratching their face, things
Mm.
that people aren't even aware that they're doing that drive you crazy inside. And it's very difficult to deal with that. But I will say, for me, quieting the noise can be just reducing that mental clutter that you have, right? You've got all these distractions. Whether or not you deal with pandas, like you may have something else you're going through, even chronic pain, like you have that noise in your mind of, "Oh, my knees hurt every time I take a step," and it's detrimental to your health in so many ways. Being able to just relieve that sense of chronic pain or that sense of anxiety that you deal with day in and day out, or just to even get a little bit of additional sleep every night so you can wake up feeling refreshed. All of
Okay.
these are very like kind of subtle, simple things, but simple benefits, but they make a huge impact on your health over time.
Hmm.
And so for me, yeah, quieting the noise can be any of those things, the things that distract us and take us away from the fulfillment of our health.
Right, right. And that is something that the chronically ill or the people suffering with chronic pain do deal with. The ruminating thoughts. It's not, we don't typically go to the positive thoughts, gratitude and,
Yeah.
happiness. It's more along the lines of what can I do to stop this from happening? So I think that this product and, there's other things that we can use to help with, we'll talk with sleep and that we deal with sleep deprivation and insomnia, or just the general inability to quiet the mind. So I would imagine that you have specific times of days that you might recommend the use of your product to help with certain things like the sleep deprivation.
Sure. Yeah, well, sleep's the more obvious one, right? You take it before you want to go to sleep.
But how
Like,
long? Like some things are about a 1 hour before you
yeah,
wind down, or should it be
sure.
immediately before bedtime?
Well, so it's not something that's like going to knock you out like a sleeping medication, right? So you could take it, 2 hours before bedtime, and you're not going to, you know, pass out on the couch necessarily. In my experience, it just kind of gives you that natural kind of, it takes that edge off. It gives you a natural sense of relaxation so that you can lay down on the pillow, rest, and get that natural sleep you're looking for. So unlike other sleep medications, it doesn't disrupt your quality of sleep. It actually kind of ushers your body into a restful state so you can
Mhm.
get the sleep your body needs. Excuse me. Which is why again, part of why I love it so much. But yeah, if you take it, so it also depends on the product you're taking. For something like a tincture or oil drops, I put it under my tongue and I wait about 30 seconds before swallowing, and it actually enters your bloodstream sublingually and gets to work very fast. It skips the digestive system, and I notice benefits within 20 to 30 minutes. I think depending on your body and your metabolism, it can take a little longer. But if you were to take a soft gel or a gummy, for instance, the onset time is longer because you actually do have to digest those actives before they start to get to work. So, one of our most popular products is a sleep gummy. And again, I'd say take it 2 hours before bedtime, maybe right after dinner to help with the absorption. Take it with food, and you will notice an improvement in your quality of sleep. With our oil drops, it's a sleepy time oil drops. My mother-in-law uses it with great results. She will fall asleep fine, but she'll wake up in the middle of the night and be unable to go back to sleep. And
Right.
so what she has done is she keeps the bottle on her nightstand, and when she wakes up at night, she'll take the bottle, put a dropper, half a dropper or a dropper full under her tongue, and roll back over. And within 20, 30 minutes, she's back asleep again. So it's definitely been greatly helpful in her life for that purpose. If you're taking it for any other reason, really, I would recommend taking it first thing in the morning just to get ahead of your symptoms for the day.
Mhm.
If you're experiencing chronic pain, taking it first thing in the morning to kind of get ahead of your pain for the day it'll set the course for your day and give you a more pleasant day in general. Some people will also split up their dose, take one in the morning, take one in the afternoon for kind of like a time released effect. Again, there's no wrong answers here. It's just about finding what works best for your body.
Right. So, and there's capsules, there's drops, and there's also, I believe, a cream and a roll-on. So, would you recommend people take a combination of these things? And we'll talk about again the chronic pain at this point, due to multiple surgical traumas, or
Mm.
just like neuropathy pain that might be developing due to the dysautonomia that they've been experiencing.
Right. Yeah. The customers who have the best results with that are using it both internally and topically. So taking something like a soft gel or the oil drops orally, in addition to rubbing a product onto the area of need directly. So like our pain cream and the roll-on are both tremendously popular among that demographic. Applying it directly to the area of need. So let's say you have neuropathy in your feet. Rubbing that product into your feet, the bottoms of your feet at night to help with that localized pain, as well as taking it internally to reduce the systemic inflammation, can be wonderfully effective. And so my wife, I mentioned she uses the pain cream for her back and shoulder pain. Again, the effects are extend just beyond pain relief. It relieves her pain, but it also helps her to sleep better and wake up feeling more refreshed. So that allows her to get into a stretching routine and get out and run and be more active. And it just kind of compounds
Yeah.
on that.
Yeah, yeah, by allowing someone to do the things that will make their days more fulfilling, and the
Yeah.
activity, that motion that is so critical too. We want to make sure that lymph is moving and we're not storing these toxins. When we're sedentary, we do store more toxins. So that looks like a very promising combination for the chronic pain community. In terms of contraindications, is there anything or any condition that they should be a little more cautious about before adding this to their protocol or to their daily regimen?
Yeah, that's a question I'm getting asked more often these days, just as people look to shift away from medication and other things they might be taking to this solution. And of course, I'm not a physician, so I can't recommend anything specific in that regards. What
Right.
I do say is ask your doctor, ask your physician about this, because if you are taking other medications, there's a chance that there could be some kind of counterindication that I'm unaware of. You certainly want to wean off those medications before starting something new, or at least let your physician know that you're doing it. More and more doctors are recommending my product for a variety of all the things we've been talking about, which is
Hmm.
very optimistic. I think it's a positive step in the right direction. But again, you're not helping yourself if you're keeping the secret from your doctor. You need to give your primary care physician a full picture of what your health looks like and what your life looks like so that they can help you to the best of their ability. So I would ask about that. I do appreciate CBD is considered very safe. I mean, it's essentially benign. I'd be shocked if there were any like negative reactions to taking CBD. The only real side effect is drowsiness, and we see that in higher doses, which is why it's great for sleep support.
Hmm.
So I would say, if you're experimenting with this, if you're trying to find the dose that works best for you, and you take some, a few hours later you're feeling kind of sluggish or tired, that's an indication that you're probably taking too much, and you can dial your dose back accordingly.
Right, right. And you did mention the way we metabolize these things, it is really bio-individual. So that trial and error process might be an essential component as you bring on something new. If you're onboarding a new supplement, any type of supplement, but it's very important to I guess, track how your body's feeling as you're bringing it on. And, some people do
Yeah.
have the awareness already, or they've done the testing for genetic predisposition or the whole metabolization process. Like how quickly are you excreting this versus if you're holding on to it a little longer. So those are just things to, if you haven't genetically tested, then just be mindful as you're onboarding things. And as Ethan said, it's always good to speak with your doctor about making any changes to your regimen. So,
Yeah, and the other thing I appreciate about CBD is that it's not something you have to take for months on end before you notice a benefit. You talk about dietary supplements, and everyone's like, "Oh, another supplement, another
mhm,
pill." Well, when I say you have to find the dose that works for you, that should take like a week,
yeah,
and you
very
should know very quickly. I mean, again, I noticed a difference in my anxiety within the 20 to 30 minutes.
good.
It's not something that you have to take for months and months before you see benefits. So if you try it and it's not working, it's probably related to the dosage that you're taking, and you may just need to increase or find something that works best for you, maybe a different format, maybe a different dose. But I appreciate that because you do get almost instant feedback. A lot of folks who leave reviews on my site say they've been taking it or giving it to their kids for 5 days, and they're noticing a good improvement. So that's really encouraging.
Yes, yes. So how can people reach out to you, learn more about your product, and get some guidance on what they can do and how they can bring it on board?
Yeah, thank you. So our website is greenvalleynutrition.com. You'll know it's me because at the very top of my website, my logo is a panda. So again, I've just embodied pandas as like who I am and what I've
Yeah.
overcome, and it's a way to help people. And that's what makes me so passionate about it. But greenvalleynutrition.com, all our products are on there. The website is a wealth of information. I have a blog on there. You can learn more about the treatment protocol that we've been talking about today. You can learn more about the products, kind of get guidance. There's a quiz on there to help point you in the right direction in terms of what product is best for you. And you can certainly reach out to us. So our phone number is right at the top of the page. Give us a call. Be happy to talk to you, learn about your experience, and help point you in the right direction. You can go on our chat. You can email us. We're here to help any way we can. So yeah, please feel free to reach out. Read the information on the website. Learn about this product. Once you feel like it could be a good solution for you, we're here to answer any questions you have.
Awesome. We will include your resources on the show notes for sure. And is there anything else you want to leave our audience off with before we finish here?
Well, I would just say if you're listening to this, you're probably experiencing some kind of health crisis, or have a loved one who is. I would just say don't give up. It's easy to look at me on this show now and see where I am today. I've got an amazing family. I'm very healthy. I've turned my life around. I still deal with the impact of PANDAS in my life, but it's nowhere to the extent that it was when I was 14, 15, 16 years old. Going through that time of my life was hell for me
Hmm.
and my parents. It was very challenging in many, many ways. And it's very hard to see past that sometimes, and I just tell people if you're walking through the fire, it is life's trials are designed to make us stronger and more capable. And if you can see that truth and move past what you're facing right now, in the end, you're going to be better equipped to help others and
Hmm.
more experienced and knowledgeable as an individual. And so I always just tell people like don't give up. It may seem like there's no hope, it may seem like there's no cure, but there probably is, and you just need to keep trying until you find something that works.
Couldn't agree more. I appreciate that, Ethan. Thank you for sharing some time with us, and I
My pleasure.
appreciate our audience. Thank you again for tuning in. Take care.